Hey everyone, this is Dr. David Song from the Rehab Hero Clinic, and today we'll be talking about a condition called Thoracolumbar Syndrome. Now this condition is pretty uncommon, but it can be affecting your low back, your hip, and your buttock. So stay tuned to see how you can work towards your recovery. Thoracolumbar syndrome is a condition that is affecting the superior cranial nerves. These nerves are nerves that only innervate the skin. They're not responsible for any motor function, which means they don't contract any muscles. That's also why when they become sensitive or irritated that they can produce pain, because their whole entire role is to sense sensation. These nerves come from what's called the thoracolumbar junction, which is where your thoracic spine becomes your lumbar spine. This area tends to become an area of high stress due to the differences in joint function. As you can tell, the thoracic spine has your ribs that attach onto it. That makes an area of high stability. Whereas the lumbar spine, the way that the facet joints are organized, promotes forward and backwards bending, like picking up an object or reaching for an object behind you. When these nerves become irritated, they end up shooting pain or creating pain anywhere along its nerve pathway, which means that they can create pain stemming from the mid-back where your ribs end and travel along that low back towards the side, into the buttock, into the side of the hip, and they can move into the front of the pelvis and into the groin region. Typically with people that have thoracolumbar syndrome, one of the common findings is that they tend to use this area dominantly whenever they do any type of activity. This means that whenever they pick up an object, they tend to focus a lot of their movement in this region. Likewise, whenever they do any type of twisting, extension, or any other type of movement that requires the spine to move, they end up using this area a lot. Moving through this area is not the problem. The problem ends up being that this area loses its opportunity to recover between bouts of movement due to the high amounts of volume that you're putting through it. So today what we're going to focus on is teaching your spine to move in the thoracic spine region. Now this area tends to be an area of high stability and therefore an area of minimal movement. However, when we teach your body to optimize the amount of movement that you got going on there, it can help to offload the amount of movement you're doing right at this TL junction. So let's get started with your first exercise called the active thoracic extension, and this requires a foam roller. Now the goal of this first exercise is to mobilize the joints of the thoracic spine. Dominantly, we're trying to mobilize the facet joints. So if the facet joints are a little irritated, try to not put the foam roller directly on them. Instead, you can move above or below in terms of where to place the foam roller. Because we're trying to mobilize each level of the thoracic spine, you will be repeating this exercise at different levels of the spine, and I'll show you how. So first, what you're going to do is you're going to place it just at the beginning of that lower aspect of your thoracic spine, kind of where your ribs kind of end. So what you're going to do is just feel for your ribs, and you're just going to place it around there. From here, be sure to keep your pelvis on the floor. You have your knees bent, or you can have them straight. It doesn't really matter for this exercise. From here, you're going to slowly lower your body towards the floor, allowing your spine to bend over this foam roller. You want your head to touch the floor and your wrists to rest on the floor as well. Once you're in this position, you're going to just breathe 3 to 5 times and just allow your body to rest. Once you've kind of gotten a relaxation effect through those muscles and joints, you're just going to come back up, scooch on down a little bit, and repeat for the next level of your thoracic spine. You're going to continue this process until you reach the base of your neck. Now this is going to take a few repetitions, but I'm just going to go ahead and skip until we kind of get to that top aspect of our thoracic spine. From here, once again, head back, arms back as well. And you just breathe through this exercise. All right. For those who have difficulty in this exercise reaching your head or hands to the floor, it's actually recommended that you place a pillow underneath your head. This will elevate the head and decrease the amount of pressure being placed on that spine of yours. With enough consistency over a period of weeks to even months, you'll find that your mobility will improve and your head can eventually touch the floor comfortably, as seen when I just did it. Now let's move on to the next exercise. The next exercise that we're going to be doing is called the Sphinx thoracic rotation, and as the name implies, it helps to improve your thoracic rotation. Make sure when you start with this exercise that you're on a padded surface like a yoga mat, or make sure that your knees are at least buffered with some sort of cushion, such as a rolled up towel. To start, you're going to sit onto your heels just like I am right now and place both hands onto the floor just in front of your knees. From here, you're going to take one hand, place it behind your head, and you're just going to rotate your upper back until that elbow gets behind your body. You're going to hold this position for about 5 seconds. You'll feel a bunch of upper back and mid back muscles fire up to maintain this hold. From there, you're just going to come back to your starting position, and you're going to do about 4 to 5 repetitions to really warm up the spine muscles. Make sure you're breathing while you're doing this exercise, and you should notice that your range of motion might even open up as you warm up. Now, the key thing that you want to make sure you're doing is that you're not side crunching to the opposite side in order to kind of cheat your way into that rotated position. You really want to make sure your chest is centered in between the midline of your body, and you're just rotating among that axis. Once you're done that, you could repeat for the other side, do another 5 repetitions, and you could do about 2 or 3 sets to really make sure that the thoracic rotation is taking effect. This next exercise is called the foam roller prayer stretch. We're going to use about a 4-foot long foam roller. If you don't have a 4-foot long foam roller, you can instead use an exercise bench, the edge of your sofa, or even the edge of your bed. So what we're going to do is, starting from this kneeling position where my heels are touching my bum, I'm just going to lean forwards with my hands, and I'm going to try to get my chest to move towards the floor while my arms are at the edges of this foam roller. From there, you'll feel your upper back stretch out, and you're going to hold this position for about 20 to 30 seconds, allowing yourself to breathe. After about 20-30 seconds, you could just move out of that stretch, rest for another 20-30 seconds, and repeat. And you can do up to 2 to 3 repetitions. Now, this exercise can be done daily. You can include this easily into your morning mobility routine. If you don't have a morning mobility routine, I highly recommend incorporating a 15-minute routine of your choice into your day. And this will keep your muscles and joints feeling nice and good moving forward. All right, let's move on to our next exercise. The last exercise that we're going to be doing today is called the thoracic cat-cow or sphinx cat-cow. You can find these exercises in my complimentary database on my website. Basically, we're going to be doing the regular cat-cow, except for we're going to be sitting onto our heels. What this will do is it'll remove our low back out of the equation for us without us having to think about it too much. From here, just like the sphinx rotation that we did earlier, we're going to put our hands right in front of our knees. And then you're going to flex your upper back or your thoracic spine. You can use your head to assist in your upper thoracic spine to flex. And then you're going to extend by having everything move in the opposite direction. So I always like to think of pushing my chest forwards and using my head to help with the upper thoracic spine to go into extension. And we're just going to do a few repetitions of this. I like to go for about 5 to 8 repetitions, but you can do more if you really like this exercise. Generally speaking, I also like to do 2 or 3 sets of this exercise as well. And this exercise, or this whole entire routine, can be done 1 set at a time, meaning you could go from one exercise to the next and then repeat. Or if you choose, just do the same exercise, rest, and then repeat the same exercise. Just choose whichever one you feel you're responding better to. And that's how you can get started on working towards your recovery for thoracolumbar syndrome. Today, we mostly focus on mobilizing the thoracic spine, and this will help with minimizing how much irritation you're putting into the thoracolumbar junction. Some other considerations you want to take is learning how to dissociate or uncouple movements between the thoracic and lumbar spine. We can make a video about that in the future. If you want to see that video, let me know in the comments below. In the meantime, be sure to hit subscribe, and I'll see you guys next time.